Menopause is a whole body experience, yet dental health is often left out of the conversation. So a new survey from Delta Dental highlights the need for better awareness and resources to help women understand and manage these changes. So earlier I spoke with the CEO of Delta Dental Insurance Company, Sarah Chavaria, about simple tips for women's oral health during menopause. Check this out. We often hear about hot flashes during menopause, but not oral health. So how does menopause affect a woman's teeth and gums?
Well, when you go through perimenopause or menopause, your estrogen level changes, and that causes reduced saliva production. And so, not unusual, 83% of women we talked to did not know there is this link, even though 40% are experiencing dry mouth, and a quarter of them are experiencing things like tooth decay, changes in how they taste, burning sensations in their tongues. So, there's absolutely a connection between going through menopause and your oral health.
So how can dentists play a role in supporting women's overall health during menopause?
Dentists and hygienists are in a really wonderful position to be a part of that preventative health. You think about 27 million Americans are not going to their doctor once a year, but they're going to their dentist twice. So that is a healthcare checkpoint with a professional where you can talk about the symptoms that you're having and open up that conversation for overall health that we're experiencing when we go through menopause. We know that 75% of dentists are ready to have that conversation, but about half of them say, I won't initiate it unless the patient does. And then the patient isn't really thinking about or doesn't want to talk about going through menopause. So we're here to try to close that gap.
What changes are you hoping to see as women learn more about the link between menopause and their oral health?
I would just say we feel really encouraged already because as we do these surveys, 70% of women say, oh my gosh, I'm going to rush out and make my next dental appointment, which is great. We want people to really learn and understand that the dental visit is part of our preventative health, and it can really open up conversations about overall well-being, overall health, mental health, and be a really great place to start that dialogue.
So what can women do right now to protect their oral health during menopause?
There's some really easy things to do. Stay hydrated, brush twice a day, floss once a day, go see your dentist, and find ways to have that conversation, ask questions, and really start that dialogue around your health.
Well, thank you so much for joining us. Where can we go for more information?
Please go to ddins.co/menopause. We've spent the last few years curating a lot of information and posting it there so you can really have a one-stop place to go and learn more about the link between oral health and menopause.
And if you'd like to see this interview again, everyone, just head to First Coast News Plus.